our plan of assessment system like a year before. So seems that we feel that, yeah, this is still a problem, because like you said that when you make it the quantification of the scoring, so the issue will be different. So like you said before that the main issue is the competent and not competent, something like that. You said, I remember for that. But we have, because our system has to quantify it, become A grade, B grade, C grade, or something like that. So it's become a problem, because how to fix the standard setting of that. So I hope that your willingness to become our research person about it, because it is also become a national issue, especially in physiology model. Yeah, because we have 92 medical faculty now in Indonesia, and we have our own each of our institution that has their own system in evaluation, and I do believe that it will become an interesting topic for the workshop. So so our plan is we will give the workshop at Friday. So I hope that you can come earlier, maybe on Wednesday, I think. Okay. So on Thursday that you can give some lecture in our faculty. You can meet our students, and then for the Friday giving the workshop, and then for the Saturday and Sunday will be our symposium. Then maybe if you want to still to stay in Palembang for longer, okay, because you can stay in my house. But if you want to go on Monday, it's okay. From Nori will come Saturday, because they have he has something to do before that, and he will come home, go home at Tuesday, because he will be giving the lecture also in faculty on Monday. So yeah, I think maybe it's our hope that you can arrange your schedule for your visit in Palembang. Okay, Prof. Thank you very much. Okay, Raisa, maybe Raisa, you can start, and by starting the introducing Professor Rob as our adjunct professor. Raisa. Halo Raisa.
Lagi ini keluar sepertinya, Prof.
Oh ya.
Lagi ini ya, di bagian tadi.
Oh lagi pindah ya.
Iya. Oh. Absensi dulu mungkin. Prof Irfan, masih ada teman-teman yang belum hadir, baru 220 orang. Silakan kasih tahu teman-temannya, ya, join.
Itu Budi, ini Zoom-nya berapa kapasitas?
300.
Oh 300 ya.
Iya.
Kalau kita sebar di teaching fisiologi, boleh tak?
Boleh, Prof. Kan ada ini YouTube-nya juga.
Oh ya.
Ya, kelas beta sebelum lengkap ya. Beta. Oke, Dr. Raisa sudah bisa dimulai, Dok. Saya absen sebentar.
Yeah. Thank you, Dr. Budi and Prof. Irfan. So we start our lecture today. Today we will hearing Prof. Robert G. Carroll about physiology of aging. Let me first introduce to you Dr. Robert G. Carroll, PhD, is Associate Dean for Medical Student Education in Brody School of Medicine at East Carolina University, Greenville, New York City. He is also the Chair of Education Committee of the International Union of Physiological Science, and he is also the member of American Physiological Society. He already published a lot of journal and also books like Elsevier Integrated Physiology and Problem-Based Physiology. So today we will divide this session into two sessions, maybe, Prof. The first one is your lecturer, and the second is question and answer sessions. Or you want the student, or the student can interrupt you during the lecture. It's up to Professor.
Okay, thank you. I've got 3 different breaks in the talk where we can discuss one topic before moving on to the next. So I have times for question and answer in the middle of the presentation. Will that be appropriate?
Yes, yes, of course, Prof.
Okay.
Like that.
Assalamu alaikum, selamat pagi, and welcome. It's my great pleasure to be invited to speak with you today. I've had the opportunity to visit Palembang and have very fond memories of my time at the institution. Today, I'm going to talk about the physiology of aging. The reason why I'm interested in this topic is not because I do research in aging, but because I am getting older. I'm now 68 years old, and I've seen the changes that have happened to my function as I age. And as a researcher, that makes me very curious about why these changes are occurring and what I can do to try and diminish the rate at which the aging has its impact on you. So my talk today is split into 3 parts. The first one is talking about the demographics of aging. The second one is talking about the effect on individual body systems. And the last one is talking about the effects on physical performance. So I also like to have questions to interact with the audience. So take a look at this question, and for the students, what country do you feel has the greatest percentage of individuals over the age of 65? If you could type the answer into the chat box, that will give us a mechanism to communicate.
Kirim jawabannya ya di chat box.
Okay, so there seems to be very good awareness that the answer is indeed Japan. It's important that we recognize that we're living in an aging world. When you look at Japan, over here, they're the only country in the world where greater than 28% of the population is older than 65. There are a couple countries where it's in 21% to 28%, in Finland, in Germany, in Italy, and in Greece. And then other countries have progressively younger populations. One consequence of this is if you look at 2,000 years ago when someone was born, the average life expectancy was 30 years. Now in 2020, the average life expectancy across the world is 80 years. So in 2,000 years ago, nobody lived up to the age at which we're dealing with now. Now suddenly half of the population is reaching 80 years of age. The reasons why that's important to you is because you're going to be practicing medicine in an aging world. All countries are going to face major challenges to make sure that their health and social systems are ready to take advantage of this demographic shift. By 2050, 80% of older people will be living in low and middle income countries. The pace of the population aging is much faster than it has been in the past. So that in 2020, the number of people 60 years and older is greater than the number of children who are younger than 5 years. So between 2015 and 2050, the portion of the world's population over 60 years will nearly double from 12 to 22%. That means all of the countries in the globe are going to start looking like Japan, more with that 28% of the population over 65. As you're going through your clinical studies, you need to realize that you're going to be practicing medicine through this era, and you're going to have to adapt your medical practice to meet that. Shifting gears for a moment, I'd like to discuss lifespan. This slide does a very good job of showing what happens from a child going through middle age and into the elderly. If you see a patient whose blood pressure is 88/37, the heart rate's 128 beats per minute, and the respiratory rate is 40 breaths per minute, what is your assessment of that patient? Again, if you could put your answer in the chat, that will give us a format to communicate.
Ayo, tulis di chat box. Menurut kalian apa nih? Dengan tekanan darah, heart rate dan respiratory segini, pasien ini bagaimana? Nobody? Nobody type, Prof.
Okay. Does this look like a normal individual?
Yeah, is it normal? Yeah, chat. Di chat
Okay.
box coba.
So we've got low blood pressure, heart rate's elevated, respiratory rate. However, this is actually a normal individual. These are the values for a normal 1-year-old. The reason why I like this slide is it emphasizes that as you anchor your idea of normal values, you have to realize that the normal values are set up for a 17-year-old male, and that is not what is typical for children. Those values are also not appropriate for elderly individuals. So you have to actually learn a whole new set of normals as you go through and use that in order to interpret your data. When you're looking at your typical values, the clinical interpretation has to include a patient's age, and the clinical interpretation must also include the patient's sex. Now, in the United States, there's a very active discussion about the difference between sex and gender. And I'm involved in national committees as we look and see how to teach this complex subject. And the tagline we have for this is every cell has sex because of its genotype. Every person has a gender. So when you look at somebody who's got an XX genotype, the gastric lining of their stomach will not be able to metabolize alcohol. An individual with an XY genotype will, and there's no hormone treatment, there's nothing else you can do to alter that. It's ingrained into the genetic profile of the individuals. So it's important to consider both sex and gender as you're making assessments of patients. This table shows the median arterial blood pressure in children. Our child that we had for age 1, systolic pressure of 88, diastolic pressure of 37 is the median value. By the time they get to age 10, it's starting to look a little more normal. Systolic pressure of 102, diastolic pressure of 61. Why this is important for this talk is an 80-year-old is not a 20-year-old. You need to learn a different set of typical values if you're going to assess the cardiovascular status of an 80-year-old. Their systolic pressure is going to be higher, say 130. Their diastolic pressure may be lower, about 70. And that will be the normal value against which you will interpret that patient's data. Staying with the developmental theme, at what age does a child's brain reach the adult size or mass? And in the chat box, you can type in A, B, C, D, or E or F into the chat box. Okay, everybody's very consistently putting in B's, and that is indeed the correct answer. When you look at the graph and you plot the percent of adult size, the brain shown in this blue line, a child reaches its full adult size of the brain somewhere shortly after 5 years of age. In contrast, when you look at their height, they don't reach their adult height until somewhere in the 17 to 18 years of age. When you look at the reproductive organs, they don't reach the adult size until in their 20s. So depending on what organ system you're talking about, each organ system matures at a slightly different rate. This difference in size is also evident when you look at the CPR mannequins and also toys. When you look at a child, when the head is about half of the total height of the individual, that's very characteristic of a newborn to a 1-year-old. By the time you get to 2 or 3, the head is about 1/4 of the average height. And by the time you get to an adult, the head is about 10% of that average height. So that when you look at the individuals, this is recognized as a young lady, a young female, a teenage doll, as opposed to a baby doll, readily just because of the difference in the head size of the individuals. When you look at how quickly the height changes and the velocity of the height changes in males and females, when you look at how quickly the height changes, when you're a newborn, that is when you have the greatest rate of change in your height. So you're born at about 20 or so inches in length. And then by the time you're 2 years old, you've already reached approaching half of your adult.
What if you're 16 years old?
If you're 16 years old, you're over in this range. There's a growth spurt that happens around the age of 16.
Puberty?
estrogen and progesterone, the sex hormones, females generally undergo that growth spurt earlier. So the dashed line for females gets a little higher here, and they show that growth spurt. Males, it happens a little later, but the same hormones, the estrogen and the testosterone, start that growth spurt. Also,
I hate to interrupt, but what if you're a transgender? Because I believe that I could be whatever I want. Would it be what I was originally, or would I have the same hormones as the girl?
So your hormone profile is set up by your genotype. If you were transgender, if you were born intersex, because the organs there was not a clear differentiation of the sexual organs. So I'm going to have to back up a little bit on this. It's a complex question and a good one.
Yeah. Thank you.
So in utero, the default phenotype is female. And that's because the growing baby is bathed in the maternal high estrogen levels. In the absence of testosterone, the female phenotype is what will develop. When you become, after birth, when you're removed from the womb, then there's a chance that the genotype may determine your hormone levels. But without the
Actually,
hormonal
can I
profile.
stop you right there? I have a
Sure.
question.
Yes.
So the chart, when it goes up, like the blue goes up, does that mean the male is getting more horny? Is that what that means? Or is it?
It means that the sex hormones are influencing the height. This is not looking at sexual
Oh, okay.
interest or anything like this.
So
The only
so like
we're
gender.
looking at size, how tall you are. So if you look at
So
a
like
group
6
of,
inches.
yeah, if you look at a group of 5th or 6th grade in the US females, they will be taller than the males in their class. If you look at that same group of individuals 3 years later, the males on average will be taller. It's because the females go through the hormonal induced growth spurt at an earlier age. If you look at them in 3rd grade, there's no difference in height between males and females. In terms of the transgender, if the hormonal profile is that matching your genotype, then this will be the profile that's exhibited. If you take supplemental hormones, you then can change these based on the exogenous hormones that you introduce into the system. By the time you get into adulthood, the height velocity in purple has stopped. You've reached mostly your adult height by the time you're 20 for both males and females. The actual average height is going to be somewhat smaller for females because of the estrogen-driven closure of the long bones, the epiphyseal plates in those long bones. So they get their growth spurt, but then that same drive for the growth spurt starts closure of the plates. So when you look at the children who undergo their growth spurt early, it'll end up being shorter because of the closure of the plates. If the microphone's not working, you can type into the chat if you have additional questions. There's also a shift in distribution in body composition as an individual ages. This is just shown for males. When you look at the newborn, half of their weight is tied up in extracellular fluid. There's only a very small amount in fat and only a very small amount in muscle mass. As you track the individual from being born up until the adult male, there's going to be a proportionate increase in the muscle mass as a percent of the total body weight and a relative decrease in the extracellular volume as the individuals go through development. So going back to the point that if you're going to look and say what is normal, you always have to change your expectation based on the age, the sex, and the gender of the individual that you're making that decision about. So as we look at stages of life, adulthood is the attainment of a physiological optimal integrated function. That's our normal function is considered to be at adulthood. You should not refer to changes that are tied with aging, either the young side or being elderly, as abnormal. They are just part of a continuum associated with development. When you're looking at how an individual ages, you'll see that there's a large difference in their types of responses. The changes in function do not occur simultaneously. Some people age at different rates than others. Changes in function also do not occur to the same degree. But it's important that you recognize that old age should not be viewed as a disease, nor should you associate any time clock with the aging process. So as you look at the significance of human aging, this is a graph that shows how many years of life you have left, and it assumes that you're at the age 50. So somebody who is 50 years old would be expected to live until they were about 80. So just like today, the average 50-year-old woman would be expected to live another 31 years to make it to 80. If you would cure cancer, that would increase the average life expectancy by about 3 years. Get rid of all cancers. Life expectancy would only go up about 3 years. If you cure heart disease, life expectancy would only go up about 4 years. If you do both, it comes out to be about a 7-year increase in life expectancy. And if you would throw diabetes into the map, you would improve the life expectancy by about 15 years. In contrast, if you would find a way to slow down aging, you could more than double the number of years that an individual has left when they're about 50. Because of this, there's a whole lot of research on aging, because the aging process seems to be what is limiting our lifespan rather than any of the disease processes that you generally focus on. There are various theories of aging to try and explain the process, but at the end, there seems to be a disruption in homeostasis. Looking at women versus men, this graph looks at the basal metabolic index versus their height. So for men, beginning down here at age 20, those lines are pretty flat. It doesn't matter how tall they are, their BMI stays relatively constant as they go through the aging process. If you look at women, the data changes. Between the ages of 20 and 29, that line is flat. But as you look at as individuals age, individuals who are shorter tend to have higher basal metabolic indices than individuals who are taller. So, and this is US data. Your starting point, how tall you are, is one of the predictors for what your basic BMI is going to be as you go through the aging process for women. In terms of physiology, the major change can be tied to a loss of compliance. Compliance is the ability of tissues to distend or their elastic response. So when you look at the heart, the cardiac chambers, the ventricular wall becomes stiffer. That means it does not relax as effectively as it should be. So diastolic heart failure is going to be more characteristic of individuals who are older. They will not have these higher cardiac output as other individuals. On the vascular systems, the blood vessels themselves become less distensible. Because of that loss of compliance, the systolic blood pressure is going to rise and the diastolic blood pressure is going to fall. So the normal blood pressure, instead of being 120/80, may become 130/70 for an individual who's elderly. Within the lungs, there's a decrease in the breathing volumes, so that the total lung capacity is going to be diminished. For the kidneys, there's a progressive loss in nephrons as you age. By the time you get to be 80, you're estimated to have lost about half of your functioning nephrons. For skeletal muscle, there is an atrophy or a loss of the muscle mass, especially those related to fast twitch. And the reproductive systems will go through menopause and andropause. And for males, the prostate enlargement is going to be characteristic of aging, because the prostate, unlike most organs, does not show any decrease in its, it continues to increase in size throughout life. So an enlarged prostate gets to be a problem for adult males. As you look at the plasma testosterone levels, you start off from fertilization in utero. There's a strong increase in testosterone, which is necessary for the development of the male sexual appearance. At birth, that decreases. There's a small increase during the first year, and then it remains low until the individual goes through puberty. At puberty, there's again an increase in the testosterone, which remains elevated until sometime after the age of 60, where there's a gradual drop in testosterone. And there's some books describe this as an andropause to go along with the concept of menopause. As you look at for women, the plasma FSH and LH in utero, it's a FSH dominated cycle. And then once you get out to birth, there's that drop during the first 6 months. And then just like for males, there's a quiescence until you get to the age somewhere around 10 to 14. At that point, the ovulation is driven by the LH surge, and the reproductive years are associated more with the
Okay, cool.
Yes.
I'm sorry, I just needed to test my mic.
Okay. And the LH surge is driven, the LH surge is driving ovulation, is going to be characteristic of the reproductive years. And then after you get to around the age late 40s to 50s, then the ovaries stop responding to the FSH and the LH, and the lack of that negative feedback causes the pituitary hormones to remain high as you go into menopause. Separate from the reproductive system, there are also age-related sensory changes. In terms of vision, there's the stiffening of the lens results in a loss of accommodation. Near vision.
Stupid nigger!
Son of a
bitch, I hate niggers, and you are.
That was not welcome. Hearing, there's a presbycusis, which is a loss of hearing, which is associated by aging. Taste and smell the loss of taste and smell begins at around age 60 or 70. And then there's also a decreased somatic sensation for touch, pressure, and pain as an individual ages and becomes elderly. But all of that is not really a problem. for each of those systems, the body has excess capacity. So you're looking at a drop in the peak performance, but there's plenty for normal activities. This slide shows an American actor, Robert Redford, when he was in a movie at the age of 64. And I can promise you I did not look like him when I was 20, and I still do not look like him when I was 64. The physical condition is driven by lifestyle choices, by stress management, exercise, and nutrition. Genetics does play a significant role, as does the environment. So the current areas of research with aging, caloric restriction is the one thing that across all studies has shown an improvement in longevity. If an individual consumes about 80% of the calories that they would consume if they were freely feeding, that increases lifespan significantly. They're looking at how to reproduce aspects of that through different dietary components. The one hormone which is showing great promise is insulin-like growth factor. The pharmaceutical companies are investing large amounts of money in this, both because of longevity and because as the population ages, there's a greater market for individuals. And as you look at the areas that have an impact on aging, most of them target reactive oxygen species production by the mitochondria. And that underscores what seems to be a substantial role of oxidants in the aging process. Looking at Google says there's a lot of interest. If you just type in the word aging, you have 600 million hits. Anti-aging, 35 million hits. If you look at scientific articles published on it, almost 5 million. In the United States, the National Institutes on Aging has a budget of almost $4 billion in 2021. That's sort of the overview of the aging process. Before we get into the effects on individual organ systems, I'd like to take a break and answer questions, have discussions. If you could type something into the chat box, or if possible, unmute yourself and participate. What if this made sense? What if this did not make sense? How does this agree with your understanding of things?
Student, if you have any question, you can raise your hand or chat on the chat box. We are very sorry, Prof, that there was a intruder.
Yes.
And I'm sure that they wasn't our student, Prof.
Oh, I'm sure it was not too. That's one of the
I don't know how
characteristics of the Zoom.
How can they get our link? So student, please raise your hand for questions.
Yeah, the increase in sex hormones during the first 3 months of life, and it's characteristic for both males and females. In utero, the maternal hormones provide a negative feedback on the pituitary for the fetus. As soon as the baby is born, the maternal hormone environment is no longer around to suppress the FSH and LH. So in the absence of that suppression, the FSH and LH levels go up, and then that will drive the ovarian tissue and the testosterone and the testes to start producing either the estrogens and progesterones or the testosterone. After the tissues have been established, the more normal FSH and LH environment asserts itself. And then it's not until the clock of puberty goes off that there's a resumption of the FSH and LH release from the pituitary.
Prof, we have a question in chat box from Sultan
Sure.
Muhammad Al-Fatih. Do humans really need to age? And because there are some animals that don't age, and thus aging inevitable.
I'm on mammals, and all mammals age. There are, if you could identify which animals that do not age, maybe I could answer that question more completely. But my understanding is that the aging is a natural part of growth. The cells replicate only a certain number of times. Each time they do that, they lose some of their telomeres, the end portions of the DNA. And so that's part of what is setting the cap on the number of cell divisions a cell can go through. So the anti-aging stuff, the best data I've seen is tied to that caloric restriction. And it works in every species that it's been tied to, from amphibians all the way up to primates and humans. If you restrict the number of calories the individual consumes, that dramatically it slows down the aging process significantly. And so the lifespan is expanded in those animals who are put on a calorie restricted diet. Is it possible to live forever? Not yet. As you go through the aging process, as I said, every time the cells reproduce, they lose a little bit of the end portion of the chromosomes. And that seems to be what that cumulative loss seems to be what ultimately stops the function of it. The stem cell as an aging process is one of the areas that's actively being researched, because that gets around the whole loss of the telomeres. Putting in stem cells, and you can, like if you're a newborn, you can save the stem cells from the umbilical cord and then use those later in life. So you would be using your own stem cells. So the genotype would still match. There would not be any rejection problems. And that's an area that they're looking at. Everybody who is promoting that is doing it for a commercial reason. The research is not as strong. So you may get the appearance, a more youthful appearance, but it's not prolonging the function. The organ functions are not being extended as much as they initially had hoped. It seems to have a better role for repair rather than anti-aging. And how genetics control the physical condition of aging. Their longevity does run in families. So that there are families where the average age is significantly older than other families. There's a lot of work being done to try and figure out exactly which genes are involved in that and how to turn on the ones that diminish the rate of aging, or attenuate the ones that accelerate the aging process. That is still as I said, these are all active areas of research and things that as you're out practicing medicine, you're going to be seeing the results from.
Yeah, so the anti-aging is not really as it sounds like, Prof. So the anti-aging is just for slowing down, I think, Prof, our aging process or to repair some impairment of our body.
Yes, those are the current uses for the stem cell therapies, and they are being very effective in those areas.
Excuse me, Prof. And Doctor, I'd like to ask a question about the topics we discussed today. Yeah.
Yeah, please, Ideal.
Okay, so as you explained to us about human is growing up and we hit our puberty, and at the end of the day, as you mentioned before, there is the term of menopause and also andropause. And I guess most of us most likely known about menopause itself because we learned a lot of menstruation cycle of the girls, and then how they would end this cycle. But andropause itself, there are still a lot of questions and seems unfamiliar. And is it means that a man would stop producing the sperm, or is it just a decreasing function of our reproductive system to produce it in large amount as we should?
Right.
Thank you.
When you look at the quantity of testosterone being produced by, say, an 80-year-old man, it's going to be much lower than a 60 or a 40-year-old man. But the germ cells in the testes are still capable of producing sperm. So it is possible for an 80-year-old man to become a father. The sperm are still viable. So it's not a complete loss of reproductive function in males. In the United States, the loss of testosterone, the decrease in testosterone is associated with the loss of muscle mass, a number of other effects. And because of that, in the US, there are a lot of TV commercials about, okay, these are drugs you can take to try and keep your testosterone levels high. And that's going back to anytime somebody's making money by selling me an anti-aging product, I become suspicious. I'd much rather get the information from scientific studies than from commercials or from people promoting things. But yeah, males can still remain reproductively capable into their 80s. But the amount of testosterone does undergo a progressive decline. In the chat box, aging blood cells. Interesting, because the red blood cells have a lifespan of about 90 days. So any improvement in the lifespan of red blood cells, I've not read about the oxygen hyperbaric therapy, and my understanding is that's exactly the wrong thing to do, because all of the anti-aging stuff is focused on decreasing the free radical production, and putting in a high oxygen environment actually increases free radical production. So I would have to see exactly what cells they're talking about and how they're getting around the harmful effects of the increased free radical production that the hyperbaric oxygen would produce. Okay. Growth hormone therapy is a solution for aging. The growth hormone therapy is not a solution for longevity, but what growth hormone does is it decreases the adipose tissue and increases skeletal muscle mass. So growth hormone can diminish the rate at which function is lost. The growth hormone itself will not extend aging, and there are harmful effects from growth hormone itself. The insulin-like growth factors seem to be the more promising of the two. When you look at, again, I go back to the United States actors. There's one actor, Sylvester Stallone, who's in his 70s and still is looking very fit and very well muscled. And it's because he abuses growth hormone like a champ. Takes it at very high levels and is very open about it. So that allows him to maintain the muscle mass, and decreases adipose. But it causes liver damage. It causes other significantly harmful effects. That is not the answer to. It itself is not the answer to aging, but the IGF-1s show some of the same benefits without the harmful effects. Okay, so moving on to the second part of the talk, the adaptations to exercise training and how that happens with aging. So all of this information comes from the Center for Health Disparities, and they're trying to look at how healthcare access affects performance and the lifestyle of individuals. So the question for you is, you have the opportunity to recruit Usain Bolt for your track team. He won the Olympic gold for the 100 meter and 200 meters in 2008, 2012, 2016. So 3 successive Olympics. He won gold in both races. So having someone else compete against him is not really going to work. He's just that good an athlete. If you had the opportunity to say which Usain Bolt you want to recruit, the 15-year-old, the 19-year-old, the 23, 27, 31, or 35, what age would you want to have if you're going to recruit this athlete for your track team? And again, you can type the answers into the chat box. Okay, spread of answers, but mostly C seems to be the one emerging as the crowd favorite. And that is indeed the age he was when he set the world record for the 100 meters. He ran it in 9.58 seconds, and that's the peak speed he had was about 45 kilometers an hour as he was running that race. So even though his fastest time when he was 23, he was still able to maintain it through age 26 and age 30, fast enough to win the Olympic gold medals, but just never as fast as the time that he attained when he was 23. Another athletic question. At what age does performance in a 10K race for males begin to decline? Okay, we're picking up some C's, mostly C's, an occasional D. And when you look at this, it's actually D and E. So a different race. This one is more focused on long distance running. And when you track out their performance, the athletes are able to maintain the high level of performance until they get up over the age of 50. So looking at the change in running records, that is, what is the 100-meter record time in the US? And as you look at the sprinters, the 100 meters, the peak time happens within their 20s. By the time they get to be 40, they're progressively getting slower. Similarly for females, the peak time is in their 20s, and by the time they get up into their 30s and 40s, the fastest time that is run in that age group has gotten progressively slower. Contrast that with the 10-kilometer race, where even going up to the age of 50, there's not that much of a change in the fastest times recorded for that age group. That it's only after you get up to the age of 50 that you start getting the slower times, and not until you're around 65 you start getting a shift in the direction of the curve to a significantly slower time. Women show that same pattern, that until through the age of 40, there's not much of a change in the record times. And then after the age of 40, some increase, but it's not until they get to be 60 that you get this relatively steep upslope, indicating that the record times are getting progressively longer. So what is the difference between the 100-meter race versus the 10-kilometer race that accounts for how age affects those two things so differently? This data is from a group in Germany that took the record times within the equivalent of a state over in Germany, and showed that the record times for individuals between 10 and 20, as you get older, the slope was actually favoring a faster time. When you're in your 20s, that slope was flat. However, once you get into over the age of 30, now the slope becomes positive. As you get older, you're going to have slower times in the race. The darker colors are for females. So females show exactly that same profile as do the males in this race performance. If you look at the 5,000 meter race, the performance, again, as you age from 15 up to about 20, you start to get faster times. It stays fast through the 20s, and then there's only a very gradual loss in function at the 5,000 meter race. So the strength changes with aging. There is a muscle mass decrease, particularly the percentage of the slow twitch muscle fibers increase, and the number of fast twitch muscles, the type 2 fibers, decreases. As you look at the performance of the two types of races, the sprint, the 100-meter sprint, is mostly fast twitch muscle. When you look at the 10K race, that relies more on slow twitch. So aging affects the fast twitch muscles much more prominently than the slow twitch muscles. Accompanying that, the nervous system response becomes a little slower. When you look at how the mitochondria function, there's very little change in the oxidative enzyme capacity or the number of capillaries. So how are you going to, in talking to an individual and coaching an individual, what type of exercise prescription would you want to involve? So you usually look for the endurance activities. You don't want them doing sprinting. You don't want them doing the powerlifting, the things that involve almost exclusively fast twitch. You like them doing the endurance exercise. The frequency should be 3 to 5 days per week or perhaps daily. The duration, 20 to 30 minutes at the appropriate intensity is the about optimal time. The intensity generally should be about 60% of their maximum oxygen consumption, although this varies from individuals and health benefits occur at much lower intensities. So as you look at the impact of physical activity on the risk of disease, even a very low level of activity significantly diminishes the risk of disease compared to a sedentary individual. Increasing your level of activity does improve the disease exposure. So you become progressively healthier at moderate and high levels. But by far the biggest change is moving from the sedentary up to the low level of activity. So making sure that individuals do at least something is a key recommendation in terms of an exercise prescription. There's a good linear relationship between heart rate, the minute oxygen consumption, and increasing work. So you've got your heart rate down here, and then as you plot the VO2 max, you get the 75% VO2 max, somewhere around 85% of the heart rate max. What this means is you can use heart rate as a surrogate for the oxygen consumption of an individual. It's got a nice tight linear relationship. Because of that, you'll have the characteristic of exercises. You'll have the individual looking at their heart rates and then their perceived level of exertion. So for individuals whose heart rate is less than 35% of their maximum, that would be considered a very light exercise. As the heart rate gets progressively higher, then their VO2 max goes up and their perceived level of exercise increases. It's hard to sustain a heart rate greater than 90% of your heart rate maximum for any length of time. So as you look at the exercise level that you're looking for, it's going to be somewhere in this range, in the light to moderate range for individuals who are getting older. The exercise programs consist of warming up and stretching, and then some sustained endurance exercise, followed by a cool down and stretching. The exercise program should include some flexibility training because that gets impaired as an individual ages, but it should include resistance training because it's the resistance training which increases the muscle mass of an individual. By maintaining resistance training, you can diminish the rate at which muscle mass is lost as an individual ages. And you got to enjoy it or else you won't continue to participate. So recreational activities are important. So because physical activity declines the same time as you age, separating those two out, what is the effect of aging versus what is the effect of reduced physical activity, is a challenge when you're doing exercise studies. As you look at the change in age in swimming records, this is a 100-meter front crawl. You see that between the age of 20, that's when the fastest times are. Then again, there's a progressively decrease, which goes along with the fact that the 100 meters is mostly fast twitch muscle. And those are the ones that are the most susceptible to an age-related decrease in time. Fast twitch muscles are also the ones that are involved in powerlifting. So when you look at the combined lift weight, the total amount of pounds lifted, there's a real steep decline tied to aging as you go through this. Again, going back to the fact that the fast twitch muscles are the ones that are mostly at risk. So the running, swimming, cycling, and lifting indicates that you're prime during your 20s and early 30s. Some swimmers have had their best performance in their 40s and 50s, but that's more improved to improvements in technique, skill, and endurance rather than muscle capability. Performance generally declines with aging after the prime due to the decrease in both muscle mass as well as cardiovascular endurance and strength. And that gets us to the second break. Questions about the impact of exercise, of aging on the exercise performance. Again, you can type questions into the chat box.
Yeah, you can type in the chat box, or if you can deliver the questions directly, you can raise your hands, students.
Okay, if there are no questions, we can move on to the last topic of the talk. And if you do have questions, type them into the box and we can come back to them at the end of the talk. So now we're going to take the view from the individual organ systems. So what are the cardiovascular and respiratory effects on aging? As you look at the blood flow, there's both a decrease in the central and the peripheral circulation. The aerobic capacity, the ability to perform, decreases at about 1% per year. The maximum heart rate decreases. And as we talked about the stiffening of the ventricles, the stroke volume also diminishes. So if your heart rate slows and the stroke volume slows, your cardiac output is going to be diminished. So as you look at taking a 25-year-old as the normal, the percent change, by the time you're 35%, you've lost about 10% of where you were. At 45, you've lost another almost 10%. And as you go through, there's a decrease in your VO2 max as you age. I was actually a subject in one of these studies as they looked at the effects of long-term aging and exercise on human performance. It's an active area of research in our university. So as you look at most of the VO2 max is based on is normalized per unit of body weight. And because we age, we gain weight as we age, that falsely lowers the VO2 max per unit of body weight. And because these individuals do not account for the initial VO2 max. So the comparisons should be based for each individual on their VO2 max and then follow them over age rather than relying on the value normalized for body mass. As you look at older athletes, there are individual differences within the rate of decline with aging. Prior training, being an athlete before, seems to offer little advantage to endurance capacity later in life unless you continue to exercise. So having once been an athlete does not really help you should you stop exercising. Aging alone may not necessarily decrease the VO2 max. So when you keep the intensity and volume training high, the rate of decrease with aging slows, especially between the ages of 30 and 50. So we've got a relatively complex graph here. You've got age on the x-axis, you've got the VO2 max on the y-axis. And as you look at the athletes who are trained for high intensity activities, they start off with a high VO2 max and they're able to maintain it through the age of 50. Then after between 40 and 50, there's a gradual decline, but these individuals still are significantly better than the non-athletes who are undergoing training or else the completely untrained individual. So if I do nothing, I have a decline in function. If I've started training, but I'm not an elite athlete, I've got this change in function. The elite athletes live up here. What this study did is it took individuals at the age of 30, the elite athletes, and for some of them, they stopped training. So they moved down to, they stopped doing the high intensity exercise and did nothing. Over the years, they ended up joining the individuals who never did anything. So having previously been an elite athlete did not provide any performance against the age-related changes. Those who stopped doing the elite training but shifted down more toward the fitness activities. So instead of training for sprinting or for high caliber competitions, just doing yoga, light exercise, things to remain fit, they rapidly joined the non-elite athletes who are also staying fit. So having once been a good, well-trained athlete did not provide any benefits as you age. For the respiratory changes with aging, most of them are tied to that decrease in compliance. Because you've lost the ability of the lungs to stretch, the vital capacity and the FEV1 decrease linearly. The residual volume is going to increase in these individuals. The total lung capacity remains unchanged. And if you look at the drop in the FEV1 and an increase in residual volume, those are characteristic of obstructive lung diseases. So just getting older predisposes your lung function to shift to someone with an obstructive disease profile. The residual volume to total lung capacity increases because less air is capable of being exchanged. The minute ventilation decreases as you age. And all of this, as I said, is tied to the loss of elasticity in the lung tissue and the chest wall. For the respiratory aging with performance, endurance training in middle and older age reduces the rate at which that elasticity is lost. The pulmonary ventilation capacities of endurance trained athletes only slightly decrease with aging. You can pretty much stop the impact of aging on the pulmonary system, and the arterial oxygen saturation does not decrease during strenuous exercise for normally active older adults. So the limitations in oxygen transport to muscles are tied to the AVO2 difference, and that's for the main cause for the reduction in the minute oxygen consumption. So I'm closing in on 70 years old. In 13 more months, I'm going to be 70 years old. As you look at the heart rate, the maximum heart rate can be estimated as 220 minus your age. As I'm 70, my maximum heart rate is estimated to be 150 beats per minute. That means by waking up in the morning and getting out of bed, I'm already at 50% of my maximum heart rate when my heart rate gets up to 70 beats per minute. So the average value for a given age can vary significantly from one individual to another. That equation does not reflect everybody as they go through the aging process. So as the cardiovascular system changes with aging, the heart rate decreases because of a drop in your sympathetic nervous system activity and a slowing down of the cardiac conduction. The maximum stroke volume is decreased because of increased total peripheral resistance and decreased left ventricular contractility. The cardiac output is decreased because of the drop in your heart rate and stroke volume changes. Because your maximum cardiac output drop, the VO2 max is decreased due to reduced blood flow to the active tissues. So when you plot out the heart rate, stroke volume, and cardiac output changes with aging, assuming 100% is the 20-year-old, the heart rate shows a linear drop as you go through to the age of 60, as does the stroke volume. The cardiac output, which is just those two numbers multiplied by each other, shows an even greater decrease as you go through the aging process. When you look at the leg blood flow and aging, for young athletes, the leg blood flow goes up with the oxygen. As oxygen intake increases, leg blood flow goes up. By the time you get to middle age, you don't show as strong a response. So the oxygen uptake is not as, you don't get as high a blood flow to the leg, so the oxygen uptake is impaired. So aging alone might decrease the cardiorespiratory system function less than the deconditioning that occurs with inactivity. So that means as long as you keep continuing to exercise, you're going to be able to hold on to the cardiovascular benefits of exercise for a prolonged period of time. For strength changing with aging, the maximum strength decreases, the muscle mass and the percentage of the slow twitch muscle fibers increase, the total number and size of the fast twitch decrease, the nervous system response slows, and there's little change in the oxidative capacity of the enzymes. So as you look at the maximum leg strength, percent of voluntary contraction, moving from standing to sitting, at 20, that's considered to be your 100%, and it's a good linear drop as you go through the strength training. For untrained men, that drop is more accentuated. If you continue to do training, even up to the age of 60, you can retain that function, and it's only after the age of 60 that you begin to see some decline. So if you are physically active, if you are doing things, the longer you can continue that level of exercise and activity is going to be the benefit. So the endurance training does not prevent the aging loss in muscle mass, but the strength and resistance training can maintain or increase the cross-sectional area in older men and women. Training does lead to an increase in muscle mass even as you age. It's just not the benefit that you see in a 20-year-old. So the key points for environmental stress and aging, the capacity to perform normal activity at altitude is not reduced with aging. So if you're going to be climbing high mountains, that's not impaired. And aging may actually provide some protection against the symptoms of altitude sickness, such as high altitude pulmonary edema. The ability to adapt to exercise and heat is reduced with aging due to a reduction in sweat production, although the acclimatization can be similar to young if you're an older fit individual. But it is a loss of the sweat glands with aging, which diminishes the ability to offload the heat as effectively. So as you age, the relative body fat increases after maturity. This is tied both to an increase in dietary intake, a decrease in the physical activity, and the reduced ability to mobilize fat. You start having higher cortisol levels. Cortisol leads to a central deposition of fat, and that's why the truncal obesity is more characteristic of individuals as they age. So after the age of 30, the fat-free mass, your muscle mass, decreases because of that loss of muscle mass, an increase in bone mineral loss, and both of those are tied to a drop in the physical activity. So as you look at men and women and their relative body fat, in the young adults, the 18 to 24-year-old, males are somewhere around 14% body fat, females are up at around 23% body fat. As you look at an older individual, somewhere 40 to 60, both males and females show an increase in body fat deposition. However, if you look at master athletes, swimmers and runners who are still remaining competitive into their 60s, those individuals do not show that increase in body fat. So training can result in retention of fitness. So if you want to remain in good shape, physical training helps offset the age-related changes in your body composition. For endurance exercise, that produces similar gains in healthy people regardless of their age, sex, or initial fitness level. It produces greater improvement in muscle oxidative enzymes than in younger endurance-trained athletes, but that's tied to the lower initial capacity. Resistance exercise is very important in older people as you age because it allows you to increase muscle strength and allows you to hypertrophy, but you're not going to get the same muscle mass increase as would a young individual working out at the same level of resistance. So the body changes with diet and exercise. As you look at the total body weight, diet alone can allow you to lose about 11 pounds. Your body fat drops about 9 pounds, and the fat-free body mass goes down a little bit. If you exercise, you can actually increase your fat-free body mass due to the increase in muscle mass. The exercise will cause the drop in body fat as well as in total body weight. And then if you both diet and exercise, you maintain that increase in muscle mass, but you have an even greater loss in your body fat. So diet alone is good, exercise alone is good, the two in combination are even better. So back to the starting slide, I am an aging physiologist. Here you can see my pictures as I go over 50 or so years of my life. And all I can say at this point is growing older is still better than not growing older. So at this point, open for questions.
Students, questions?
Yes, we have a couple coming into the chat box. So why is the athletes who stop exercise decrease performance more than the non-athletes who kept maintain the exercise? And that's actually where a whole lot of the research is being done now. So let me try back. That long ago, I think I'm gonna get there quicker. So most of the research is being done trying to see what is the lowest level of activity it takes to maintain fitness. So it's not how hard you have to work to get fit, but it's what is the least amount of effort you have to put forth to remain fit. And that's why they took these individuals at the age of 30 and put them on different characteristics. The reason why this decline happened so rapidly is all of this improvement. The reason why these guys had a higher VO2 max than the sedentary or the ones who were doing general low or non-elite level athletic performance. All of that gain happened because of that training. As soon as you remove the training, then they revert back to whatever muscle characteristics are for the, their body will adapt to whatever level of physical activity is being asked of it. So the 220 minus your age, does that work out at any age? It really seems to. I've been tracking my maximum heart rate as I age, and I'm falling right into that equation. So there will be variation, but there's also variation. Not everybody's peak heart rate is 220. So there's variation both on that starting number, but there is a very predictable drop in your maximum heart rate with age. So when an athlete has a serious injury and decreases after the prime, is it possible to improve? And that one I'm going to go, I played and coached rugby for a long period of time. And I'm going to have to say it's tough. Because the prime for most athletes is in their early to mid 20s. Any serious injury that goes against the fast twitch muscles, the sprinting, the powerlifting, things of that nature, it's unlikely that they're going to ever recover back to where they were, because the effects of age are going to diminish how much they can recover. So the risk of sports injuries in older people, the activity that I do is actually walking at a fast pace. So that's the being familiar with this data. About 5 years ago was the first time I started reading about the topic, and that's when I started exercising. So the walking at a fast pace gets my cardiovascular level high. I've not yet started working in resistance exercise, but now that I'm getting close to 70, lifting light weights is going to be part of my exercise activity, because that will allow me to lay down the muscle mass. Most of my focus has been on cardiovascular fitness. And I walk for 5 kilometers at least 3 times a week, at a rapid rate, enough to get my heart rate up into the 125 range, which puts me right at that 70% of the VO2 max. Question for the previous slide, giving chemotherapy. Does giving chemotherapy to elderly lung cancer patients work effectively and extend their life? I've got nothing on that. So I would have to refer you to the individuals, who are doing that. And this is a physiologist, I'm not a physician, but my take on the chemotherapy is that chemotherapy is designed to kill, to harm fast dividing cells. So when you destroy cells, the tissue that usually replaces them is fibrous tissue, and it's not going to be able to stretch as well. So it will improve their life expectancy if you've gotten rid of the cancer. They're not dying of old age, they're dying of the cancer. So yes, life expectancy goes up, but if that would not be an effective way for a normal individual without cancer, I don't think there would be a benefit to maintaining lung function by taking chemotherapy. That the only benefit would be for the individuals who are already combating a form of cancer. The vegetarian and vegan lifestyle, that's got a whole lot of research going for it. And a lot of that is tied to the fact that most of the vegetarian and vegan lifestyles have that reduced caloric intake. When you look at the benefits of animal protein versus plant proteins, there is not a significant difference in the types of amino acids that are part of it. Once you digest it, they become fairly similar. The animal proteins will not have a lot of the fat that's associated, the plant proteins will not have a lot of the fat that's associated with the animal proteins. So there is that benefit. But generally, the vegetarian and vegan lifestyle are associated with a reduced caloric intake, and that does improve longevity. The area that I've done some work on is the impact of amino acids on kidney function. Initially, it was thought that the vegetarian and vegan lifestyle would decrease the rate with which nephron loss occurs, but they found out that that was just due to protein restriction, not the nature of the protein. And even the protein restriction did not seem to have that pronounced an effect. So for maintaining renal function, that was initial data said that would work. The more recent data has called that into question. Specific factors that exercise influence and slows down aging. Mostly, and this will go, the exercise, you'll include yoga, you'll include the stretching activities. Most of the harmful effects at the individual organ system level are due to the loss of compliance. By keeping the lungs active where they're stretching, by keeping the blood vessels active where they're stretching, you can slow down the rate at which function is lost. So there will be some intrinsic loss of function. You can't stop it from happening, but you can diminish the rate at which it occurs. And elderlies who have a process of physical decline, joint blurred vision. In the instance of ordinary people, will exercise improve their health? Yes, pretty significantly. So diabetes is related to blood circulation, cardiovascular. So my wife has type 2 diabetes, and she controls it with exercise and with making sure that her diet includes protein at the same time a carbohydrate is ingested. And because of taking those two steps, she's been able to avoid going on any medication. So exercise does improve your body's ability to handle blood sugar. It has a non-insulin dependent mechanism for getting glucose into the cells. And so, yes, very, very clearly, exercise will improve the health of an individual, even individuals who are diabetic who are taking medicine, particularly type 2 diabetes. Type 1 diabetes, I think they're stuck with having to remain on the insulin injections. But as you get older, you can handle the age-related changes in glucose metabolism through diet and exercise. Okay. And with that, I think we've coming close to the appointed hour. here. Dr. Raisa,
Yes, Prof.
any last things to do before we conclude?
Oh yeah, there's actually a lot of question on the question box, Prof.
Okay.
Yeah.
Regarding the difference in healing. So will the healing ability who are doing physical activity be higher than the people with lower? And I'm going to have to rely on personal experience. I played sports for a long time, and one of the things that happens at the skin level, I've lost a lot of subcutaneous fat. So injuries that didn't used to create a bruise now bruise me. Things that didn't used to scratch or break my skin now will scratch and break my skin. And a lot of that is tied to the loss in the subcutaneous fat that's characteristic of someone who's older. In terms of the rest of the recovery, the estrogens and the testosterone are growth factors. So as you age and the estrogen levels drop and the testosterone levels drop, that will diminish the effectiveness with which you heal. So the healing pretty much across the board by the time you get into the sets of older than 60 is going to be not as great as it was when you were 20.
Yes, thank you, Prof. If there are any other questions, Fatia, you have raised your hand before. Do you still want to ask questions?
I already asked my question. Thank you.
Oh, thank you. So, Prof, before you deliver your conclusion, I want to ask you something. Maybe you can give us some tips on what is your secret to stay healthy at this age, Prof? Because you don't look like a 70 years old person.
There are days I feel like I'm 70.
What's your exercise or maybe eating habits that we can learn from you?
Yeah, mostly it is diet and exercise. The weight that I'm at now, I was at this weight when I was 20 years old. The muscle mass is redistributed, a lot more of it's fat than in skeletal muscle, but I've been able to keep my weight fairly constant through paying attention to diet and exercise. And it was only after starting to read up on this data that I became more intentional about exercising at least 3 days a week. And that's going out and walking at a fast clip for 3 miles for 5 kilometers. And those two things have enabled me to at least feel like I'm not aging as fast as some of my colleagues. But there's unfortunately no magic bullet for how to stop aging. The best we can do is try and retain whatever function we have.
Thank you for delivering your tips for us, Prof. Maybe you can give us the conclusions. I think there's no other questions from the audience.
Okay. So the conclusion is actually tied from one of the earliest slides. It's important that you as healthcare providers, as physicians, become aware of the impact of aging and how it is going to change how you practice medicine and the population that you're going to be practicing medicine on. That there's no way that unless you go into pediatrics or something, there's no way you can avoid the fact that your patient population over the next 30 years is going to get progressively older. and you're looking to be practicing medicine right as that aging group reaches the age where they're healthcare consumers. So pay attention to the age, sex, and gender of individuals as you're assessing their function, and encourage them to get out and exercise more.
Thank you, Prof, for your lecture today. We hope you stay healthy and young as you age.
Thank you.
See you
Thank you
again
very much, Prof.
in person, Prof,
Yeah.
on September.
And I look
Okay,
forward to
sebentar.
you coming to Palembang in September to
Yes.
see campus.
Maybe Prof Irfan wants to say something
Yes.
to
Yeah. Okay. Thank you very much for Prof. I think it is a great lecture for our student and a lot of inspiration that they got from this lecture. And yes, I do believe that the aging is one of the hot topics right now, and I think student very exciting for that, and we are very grateful for this lecture, and I do hope that we can still keep in contact and will be meet in September when, and I do believe that we still arrange our plan to September meeting, and soon that I will email to you about the more detail about the itinerary or everything and about the topic of the meeting. Thank you very much, Prof.
Very good. Everyone have a
Yes.
good day.
Okay, bye-bye. Thank you.
Bye-bye.
Terima kasih adik-adik semua. Kasih ucapan selamat ke Rob.
Thank you, Prof.
Thank you,
Bye.
Professor.
Professor.
Thank you, Prof.
Thank you, Professor.
Professor.
Terima kasih.
Terima kasih juga untuk para dosen-dosen faal se-Indonesia yang ikut hadir ya. Ada Dr. Diniwati dan juga Dr. Ermita dan segala macam. Terima kasih semuanya. Sampai ketemu.